Hi, my name is Hilma Volk, and I have been a licensed massage therapist since 1991, and I am the creator of the program Carpal Tunnel Master and Beyond, which has been online since the beginning of 2011. But the origins of that have come from many trials and errors and experiments in developing techniques over the years as myself as a massage therapist, originally developing techniques to use on my own overworked hands, and then onto clients, and then on to the general public. And I'm not going to tell much about myself because you can read about me in the links that are down below. Now, first of all, let me tell you how my program is different than other carpal tunnel programs. Because first of all, carpal tunnel syndrome is not the main cause of numbness, tingling, pain in your hands, wrists, and forearms. There are other causes as well. And most programs on carpal tunnel only focus on the carpal tunnel programs. And there are other things that mimic carpal tunnel, several things that mimic carpal tunnel syndrome. And there are also other things that don't mimic the same symptoms, such as if your little finger's numb and the middle of your ring finger is numb. That's not a symptom of carpal tunnel syndrome at all, but it is a problem. And most programs don't deal with that. If your thumb's in pain, if you got real sharp pain in here, of swelling, and it just hurts all the time, that's not a symptom of carpal tunnel, but it is a problem. And other programs usually don't deal with those. Also, most programs about carpal tunnel, not all, but a lot of them, tell about how they solve their carpal tunnel syndrome, how they reversed it, which may not be for the same reason that you have it if you have it. And so what works for some people may not work for you. Also, most programs rely on stretching and exercises. And while I have a second section that covers a lot of stretches and exercises, it's not the main focus of my program. In a bit, I'll talk about why I believe that self-massage is much quicker and more effective than stretching or exercises for carpal tunnel syndrome and other muscle imbalances in the body, because a lot of pain in your body is caused by muscle imbalance somewhere. Anyway, the carpal tunnel is a ditch in the wrist made up of wrist bones, and across the top of that ditch, with your palm is forward, is a hard strap called the transverse carpal tunnel ligament. It's not the only name, and it's probably not the best name, but that forms a tunnel. In that tunnel is the median nerve, and the median nerve, if it's pinched, will cause numbness, tingling, or pain in the thumb, first finger, middle finger, and half of the ring finger. There's also 9 tendons that go through there. They're called flexor tendons, and flexors are the ones that close the fist. Close the fingers, make your fingers go down, and each individual tendon goes through a tube. It's called a sheath. It's a hollow tube each individual tendon goes through, and in that sheath is lubricating fluid. It's not as hard as motor oil, not as strong as motor oil, but there is lubrication in there, and that allows the tendons to go back and forth, back and forth, back and forth, back and forth when you're moving your fingers up and down. And what causes those fingers to move when those tendons go up and down is the forearm muscles. So every single movement that I'm doing right now is caused by forearm muscles, not muscles in the fingers. There's muscles in the fingers that open and close your fingers outward, but the forefingers, not the thumb so much, but the four fingers are entirely moved by the forearm when they're going up and down. The thumb's a different story. It has components in the forearm that move it up and down too, but there's also huge, compared to the size of the thumb, muscles in the thumb that are giving a lot of people problems, especially with tablets, smartphones, but there's other things that can cause a pain too, and most programs don't deal with the thumb pain. So why do I believe that self-massage gives quicker and better results, or at least quicker results, than stretching? Well, when a muscle's imbalanced, there's a problem in the muscle. Either muscle fibers are stuck together, which are called knots, and I won't go into a lot of detail here, or you've got muscles stuck in contraction or stuck open, and they're not in spasm, they're just stuck. And those areas will be tender when they're pushed on. You can take a perfectly happy muscle, and if you push on it, you'll just feel pressure. You will feel no tenderness. But say you've got these spots in your muscle where they're stuck together fibers, knots, or muscles stuck open or closed, and you stretch on them. Well, the parts of the muscle that are perfectly happy and able to stretch, they're going to stretch nicely. Well, by the time you've gotten done stretching, you've probably just barely reached the problem areas in the muscle because you've stretched those parts that are easy to stretch, and the parts that are harder, they get left last. So unless you keep persisting with the stretching, you're not going to reach those areas first. You're going to reach them last. And usually by the time they get there, you're done stretching. So if you work on those problems directly, work on the knots directly, work on the trigger points, which are muscle fibers stuck open or closed, then you will achieve much faster results because you're working on the problem areas and not trying to stretch them out that way. Another problem with stretching with some people is you've heard all your life, no pain, no gain. Well, with stretching you don't want pain, because pain is a signal that something is wrong, that your body does not want to be stretched any further. There's nerves in your tendons that say, hey, we've stretched enough. Any more, you're going to hurt us. So if you overstretch, if you stretch into pain, you could very easily rip something and it takes longer for you to heal. And if you've got tendons that are already damaged, so tendons by the elbow, if they're already damaged and you start pulling real hard on those, you could rip those even more. So you don't want that. Does stretching work? Yes. Does it take longer? Yes. And people may say, well, a silly little massage isn't going to do anything. Well, you're right, a silly little massage isn't going to do anything. A little slide and glide petting massage is not going to do anything at all, but very specific ones will. Now, I mentioned that there are other things that can mimic carpal tunnel syndrome. That's because the nerve can be pinched anywhere along its nerve pathway. The primary places where it can be pinched is it comes out of your neck at the lower vertebrae, and the nerve travels under your collarbone, down under your armpit, down through your elbow, and down your arm to your fingers. Now, if there's pinching anywhere along there, it can mimic carpal tunnel syndrome, or if it's pinching other nerves, it can cause other problems that are not carpal tunnel syndrome, but they're still problems, and you want to get rid of them. And the main cause of these things is muscle imbalance. Now, why is there muscle imbalance? It's because most people do things in front of their bodies. You got your shoulders forward, you got your neck forward, especially getting worse and worse now with more and more people, including kids, using smaller and smaller computers, so they have to hunch themselves into a ball to look down at it. And for every inch forward your neck is, that puts 10 pounds more of pressure on your neck, because your head already weighs about the same size as a bowling ball, the same weight as a bowling ball. So moving your neck forward, that puts pressure. So these muscles in the front tend to shorten, and the muscles in the front here go underneath your collarbone and to the first and second rib, and they pull up on those ribs, and that can pinch the nerve that goes underneath. And it can mimic carpal tunnel symptoms. And when it goes under the armpit, it can mimic carpal tunnel symptoms. It can also affect the whole hand if it wants to, or just these two fingers. And pinched nerves through muscle imbalance in the forearms can mimic carpal tunnel, or it can cause problems in the little two fingers. And they're problems, and most programs don't address them unless they're addressing those things very specifically. So my program does, but also if you're doing those things with your head forward, with smartphones, tablets, whatever, all laptops, notepads, you want to make sure you're doing things every day to unwind yourself, because these things will cause muscle imbalance that will roll you into a ball, and that causes headaches, that causes neck pain, not only pinching of nerves, it causes pain between your shoulder blades, all kinds of problems. So you want to use your smartphone smartly, and most people don't. Also, thumb pain from holding tablets all the time, when there's accessories that can take care of that for you. Using your thumbs all the time for texting, when thumbs are more vulnerable to repetitive work than even fingers are, because you're using those thumb muscles, which are not designed for repetitive use. And my program covers a lot of these things, all these things, and most programs don't. Now, what is the doctor alternative to carpal tunnel massage or exercise or whatever? And medical people use medical devices. And not all doctors are created equal, and not all doctors will go an invasive route. But it's been shown through research that those doctors who have a financial investment in a surgical clinic are 159% more likely to recommend non-emergency surgery than those who do not have a financial investment in a surgical clinic. Also, other invasive things are shots, primarily cortisone, but there's other things they can use. And cortisone is a very powerful anti-inflammatory, and it's also very powerful for doing other things. And usually it gets rid of the symptoms for a short period of time. It could be 2 months, 2 years, whatever, but it doesn't last. The symptoms come back, the problem comes back. But the thing with shots is most doctors, most reputable doctors, will not give you a cortisone shot anywhere in the same place more than once or twice, usually not more than twice in your lifetime, because cortisone is very powerful. It can deteriorate tendons, it can deteriorate skin, it can deteriorate bones, it can deteriorate muscle, and you better know what you're doing if you're giving a cortisone shot, because you just don't say, well, I'll give you a shot and hope it helps. You better know what you're doing, because these things are very powerful. And like I said, they can deteriorate things, so if you go to a different doctor and say, I've never had one before, and you're getting 3 or 4 shots, you could ruin your hand permanently for anything, and it's totally not reversible. Okay, the other thing is drugs, and I've got a whole video on drugs that I've made previously, and I'll add it to this page. But the reason anti-inflammatory drugs are bad, besides the fact they don't work, anti-inflammatory drugs, whether they're over-the-counter or prescription, have never, ever, 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 ever cured carpal tunnel syndrome. Not only that, in the long run, they make your problem worse. They may relieve the pain for a short period of time because they are reducing the inflammation, but in the long run, they make your problem worse, especially if you're using them all the time, and I'll show that in another video. And it's not just because of all the potential side effects. And every pharmaceutical, whether it's over-the-counter, whether it's aspirin or ibuprofen or whatever, they all have potential side effects, and some obviously worse than others. The other thing they use is surgery, of course, and I'll talk about that in a second, and then wrist braces. Now, for sleeping, a wrist brace or wrist splint is a good idea, because your wrist tends to flop around at night, and if you're having problems there, closing the wrist forward can make the carpal tunnel smaller. Now, if using a wrist splint at night helps, that means you've got imbalance in the forearm, because imbalance in the forearm pulls your carpal tunnel forward. Because these muscles, the flexor ones that move your fingers closed, that move your fist closed, that most people use much more than the ones that extend your hand, there's muscle imbalance there, and that's making the carpal tunnel shorter. It's not the only reason for carpal tunnel, but it's the major or a major reason for carpal tunnel syndrome. And when people say, well, vibration causes carpal tunnel. Well, the reason they say that with some people is people who use vibrating machinery a lot. The worst I can think of is jackhammers, but there's, lawn equipment and motorbikes and all kinds of things, mountain bikes even, is the reason is you're gripping so hard with those that you're causing muscle imbalance. You're gripping them in order to hold on to them. So it's not the vibration, it's the fact that you're holding on so much and gripping and using those extra the flexor muscles way more than the extensor muscles, creating tremendous imbalance in there. And it's reversible by reversing the muscle imbalance in the forearm. Okay, now surgery. Hello, hello, hello. The reason they do surgery is to give more room in the carpal tunnel. Now, if it's caused by muscle imbalance, rebalancing the muscle will give the room back in there. I'll talk about another reason in a second, but let me talk about the surgery first. What they do is they just snip that carpal tunnel ligament, snip, snip, and depending on what type of surgery you have, they will tell you, oh, it's a real easy surgery, and it is. Depending which kind of surgery you have, very relatively simple compared to getting your appendix out or something. But a lot of people expect, well, if they've had their appendix out or something like that, you think, well, when I get done, it'll be all better. Not usually so. Because in almost all cases, cutting that will make your hand weaker than it should be. Why? Because the purpose of this strap is to provide leverage for gripping, for strength. Now, if your hand's weak, it's also because your muscle imbalance creates weaker muscles because you've got all that buildup in there. Muscle imbalance makes weaker muscles, as does pinching of the nerves. But if you cut the carpal tunnel ligament, you're weakening the hand, and you may never get that back. And some people who eventually get the strength back, it often is because scar tissue is formed in there. Now, sometimes the carpal tunnel syndrome comes back after surgery. It may take 7 years or so, but if scar tissue is building up in there, it's making the carpal tunnel smaller, and the symptoms come back again. Also, according to the American Association of Orthopedic Surgeons, they say the carpal tunnel success rate is 85%. But their definition of success is that the pain is gone and the numbness is gone, but consumer reports of carpal tunnel surgery, the consumer success complaints or whatever, shows a 60% dissatisfaction rate. And why is that? Well, usually because you have mixed results. In about a third of the case, everybody's kind of happy with the surgery, and it doesn't come back, and oftentimes that's with people who are not having to use a lot of strength with their hands, for example, if you're just typing or something. But if you're using strength, if you need strength, even for a musician, you may not get that strength back. Also, when the American Association of Orthopedic Surgeons says there's a 85% success rate, that means there's a 15% failure rate, which is actually much higher than that, by the way. But if they say that there's a 15% failure rate, that means that out of every 20 people that walk through the door, 3 of them are going to be worse off. They're not going to be the same as they were. They're absolutely going to be worse off because they've had the surgery. But there's also risk involved. There's the chance of infection. People have had nerves actually accidentally cut. There are people who, they go around a year later, they're saying, why is my hand not better? And another reason for failure is it was never properly diagnosed in the first place, and that's a very common one, more common than it should be, that it was never carpal tunnel syndrome in the first place, or it's a combination of things where you may have pinching here, pinching there, pinching there, pinching there, because we're all kind of huddled in a ball in a lot of our occupations and hobbies. So accumulation of things, the carpal tunnel surgery only resolved a small portion of that, so you've still got the rest of the problem that the doctor did not take care of. So no matter what the problem is, unless you are in danger, unless you're in danger of permanent nerve damage, surgery should always be a last option for an elective surgery. We're not talking emergency surgery, you're talking about an elective surgery, and there's time. There is time to do things, because you have a surgery, you're not all of a sudden all better, even in the best surgeries, even in the best outcomes. It takes at least 3 weeks of recovery, up to 3 months. And 25% of the people who have the surgery cannot return to the job that they had before. And I linger around the internet seeing what people have to say who have had surgery and whatnot. There's one gal. She had her surgery 5 weeks ago, and she says, "Why have I got this burning pain? It just burns, burns, burns." And then in the next forum post, she's talking to somebody else, and she says, "Well, the surgery only took 2 minutes. It took 2 minutes, but 5 weeks later she's in terrible pain. What's going on here?" The thing is, if a person takes 3 weeks to recovery, if they had spent 3 weeks, and usually it doesn't take that long, but it depends how tight your muscles are to begin with. It's going to vary on what your situation is to begin with, but if you spend 5 minutes 3 times a day, chances are most of your problems are going to go away fairly quickly. Fairly quickly. So instead of spending 3 weeks of recovery time when you have a risky surgery that doesn't guarantee that your hand's going to be back to normal the way it should be, as opposed of trying to get it better back to normal without anything invasive, why not choose the non-invasive route? And I look at these carpal tunnel forums where people are, saying, "Well, I had my hand in a brace for 8 weeks and it worked. I wish I had done that for the other hand. Maybe it would have done the same thing." But that same person who has their hand in a brace for eight weeks, they haven't done anything for themselves in the meantime. They haven't done any exercise, they haven't done any stretches, they haven't done any self-massage, and they've just let that hand be in a brace for 8 weeks. So they've had minimal use of their hand at that time, and their hand is better. Why? They've let their muscles atrophy. If you've looked at anyone who's had a broken arm and the cast comes off, the muscles have atrophied. They're skinny. So what happens to muscle imbalance? The muscle imbalance is gone. What happens to any swelling that's gone into the hand because of repetitive use? And I haven't discussed what happens with swelling in your hand from repetitive use, but they're not using that repetitive use for 8 weeks, so that's gone too. So they've eliminated the problem, but they haven't done anything to learn anything. They've just had that hand sitting there in the cast while they go about their business, not using their hands very much. But if they had done things to reverse it, if they had been active, they would not have needed that brace, because once they get the brace off and they do everything they did before to get them to this carpal tunnel syndrome that caused it, guess what? The only thing they've learned is that a brace for 8 weeks work, and they might say, "The heck with it, I'll just get the surgery because it's not worth having the brace on for another 8 weeks." You see what I'm talking about? If you're a person who wants to do something for themselves without going through the medical hassles of surgery and shots that are absolutely ineffective, by the way, for curing anything, or, well, the shots will help for a short period of time, but the drugs will not cure anything. Even the Mayo Clinic says there's no indication that it's effective, but there is indication that it is harmful in the long run, and some doctors know that. Some doctors do know that, but the doctor who prescribes you drugs for carpal tunnel syndrome is absolutely the wrong doctor. So if you want to go to the doctor route, do not go to one who prescribes you anti-inflammatory drugs, because that does not cure carpal tunnel, ever, never has. Now, my program, Carpal Tunnel Master, has helped hundreds of people. It's been online since the beginning of 2011, but like I said, I was developing it long before then. But it's helped hundreds of people online. And it's got a very, very low refund rate, even though I have a 60-day, 100%, no questions asked, money-back guarantee for it. But I've got a 5-star excellent rating on ClickBank, which is a program where I sell the program through. And it's a 5-star rating based on excellent customer service and satisfaction. Okay? Now, let me tell you a little story about Jim. Not his real name, but a real person. Lives in the UK, United Kingdom, and he ordered my program, and within 2 days he canceled and said it wouldn't help him. Well, I wrote back saying, well, I'll be happy to cancel and refund your money, but I'm very confused. You've only had the program for 2 days. That's not enough time to look at the videos and absorb them and even try things out. You know, and I said, I'll be happy to talk you through them and see if I can help you solve your problem. He wrote back and said he'd be very happy if I could help him with his program, with his problem rather. He was a dirt bike racer, and he was semi-pro and wanted to turn pro. But the problem was that every time he got on his bike, within 10 minutes, his hands would go numb. And so I wrote back, you know, I would have been happy to talk to him on Skype, but we were doing emails back and forth, which took several days. And I said, well, do you have the problem when you put your hands down after you get off the bike? He said, no. After 10 minutes it goes away. And I knew he did not have carpal tunnel syndrome. He said he had already tried every massage technique and every stretch and exercise that there was for carpal tunnel, and none of them had done any good. He tried splints, riding with splints, they didn't help. He even had a cortisone injection from a doctor, and that didn't help. So nothing had helped him before. And I told him to go through my videos and look at the pectoralis minor videos, because that's what it seemed like to me that it was. Because very good clue, you got your arms up, got your hands get numb, put them down, the numbness goes away. Bing, look at, if he had looked at my introduction program in the core videos of the program, he would have known what his problem was. He could have gone right to that video talking about that problem and solved his problem right there. But he didn't. He skipped right to the area about hand, wrist, and forearm. And he argued with me saying, no, he had the same symptoms as carpal tunnel surgery, as carpal tunnel syndrome, because he had the numb finger and numb thumb, first finger, second finger, and their finger, same symptoms. But they weren't the same, because if you put your arms down and they're not numb, that's not carpal tunnel syndrome. So I pleaded with him, you know, go watch the videos. They'll show you what your problem is and how to fix it. And I told him about the dimmer switch analogy. Now, let's say you had a lamp over there and a wall switch over there, and along the cord that goes in between them, there's 5 dimmer switches. Now, if you look at that lamp and it's dimmed, unless you examine each dimmer switch, you cannot tell where the dimming is occurring. You cannot tell if one switch is dimmed, you cannot tell if they're all dimmed a little bit, or 2 of them are dimmed more than the other, or if they're all open except, you know, you cannot tell by looking at the lamp. The lamp does not know which dimmer switches are dimmed. And let's say the analogy is instead your nervous system going from your brain into your hand, and along the way there's a dimmer switch here, there's a dimmer switch there, there's a dimmer switch here, there's a dimmer switch there, there's a dimmer switch there. Your brain does not know where the nerves are being pinched, and your hand does not know where the nerves are being pinched. If your thumb and finger in here are numb, you think the numbness might be coming from here, or they might be coming from here. The body's weird that way. So you have to check all the places along the nerve pathway, which most programs don't even touch. And once you figure out, and it's not that hard to figure out, then the fix is really easy, because you need to correct the muscle imbalance that's causing the nerve pinching. Now I'll tell you one other reason for carpal tunnel syndrome. The other reason is repetitive use of the fingers. Now repetitive use, you're playing a violin, any musical instrument, guitar, you're typing, whatever, and the fingers are going back and forth, up and down, which makes the tendon inside go up and down, up and down, up and down, up and down. And like I mentioned before, the forearm muscles are contracting and expanding, and when they contract, your hands goes like this. So when the ones in the back contract, it opens the hand, and the ones that close the hand are well more used than the ones that open it. And this can become from weightlifting when you're closing your fist all the time when you really don't need to. Anything like that. But the repetitive stuff, inside each little tube that each tendon goes through, there's lubrication in there, and that tendon, when you're moving your fingers, is going back and forth, back and forth, back and forth, back and forth inside that tendon sheath, which is a tube just filled with lubrication. Now, if you've been typing for an hour, chances are that fluid is dried up in there. Because you're supposed to take breaks every 20 minutes. If you've ever heard that before when you're typing, do something else. File something, go to the bathroom, take a break, whatever. Look at your email, answer the phone, whatever. But don't keep typing for longer than 20 minutes at a time. Give it a rest for 5 minutes to let that lubrication get back in there because it dries out. Now if you're using a lot of people use their computers improperly. They're typing like this, they're typing like this, they've got their hand at an angle like so. So these tendons, instead of going in a straight line is where your back of your hand and the back of the forearm are in a straight line. Instead of those tendons going in a straight line, they're going around a corner. And so the tendons going back and forth, back and forth, back and forth have to go around a corner. And if you've seen a rope pulley, rope going around a tree, guess what? It's chafing stuff off the tree. If it's a cable, it's chafing stuff off the tree more. The rope might be breaking off too. And there's little pieces of your inside of your sheath, or maybe even parts of your tendon breaking off in there. And what happens? That's irritating. It's very irritating. And so your body sends fluid in there to help get rid of the irritation, to take care of it. But if you just keep on typing 20 minutes, without stopping, it's dried up more and more gunk gets put in there. Now, what the body normally does, if you've got inflammation, it takes care of it. There's killer T cells, and, well, it's basically white blood cells that can ooze in and out of things and gobble up stuff that's not supposed to be there, like dead skin cells. But if you don't allow time for that to go in there and remove it, it's going to build up and get gunk and keep swelling more and more, and that puts more pressure on the median nerve because the swelling is not the tendons themselves, it's the swelling inside the tendon sheaths from all the gunk that's being built up. Now, if you add to that anti-inflammatory drugs, this is why I say drugs are bad for carpal tunnel. Especially if it's from repetitive use and you've got swelling inside the carpal tunnel, is because the white blood cells are supposed to eat that stuff up. But if you're taking drugs, guess what? They're asleep in the firehouse. They don't know there's a problem there, so they don't go there. So you want to use mechanical means, or ice, to encourage the white blood cells to get in there. You want to encourage the white blood cells to get in there and clean that stuff up. If you're using drugs, the white blood cells don't know because the brain doesn't know to send them to get in there. You see what I mean? For the short period of time, hey, the swelling might go down and you'll feel better. For the long run, problem worse, you may be doomed for carpal tunnel syndrome. So, either that or wear a brace for 8 weeks and let that all subside and let the white blood cells finally get in and take care of themselves, and then learn how to do things properly and learn how to take care of yourself. Now, like I said, $47 may sound a lot to some of you, but the average price of a physical therapist visit might be $85 to $95 or more. A doctor visit, just talking to a doctor for 5 minutes, will probably cost you about $75. Surgery, anywhere from $8,000 to $14,000. A cortisone shot, $250, $300, depending where you go. You know, so relatively speaking, my program's pretty cheap. But I also give a 60-day money-back guarantee. If you go to a doctor, they're not going to give you a guarantee. And if you go to, usually they'll send you to for a nerve conductivity test. That's not cheap. Ka-ching, ka-ching, ka-ching. And then you've got the office visit time, the time of travel to the office visit, the waiting in the waiting room, and on and on and on, ka-ching, 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 when you should always, always, always try a non-invasive approach first. No matter what you try, you should always try for a non-invasive approach first, unless you've let it go so long that you're in danger of permanent nerve damage. Because when a doctor says you've got nerve damage, that's frightening. But it also implies that they're going to fix the nerve. Like I said, unless you're in danger of permanent nerve damage, you can almost always reverse that, because a doctor is not fixing your nerve when they do carpal tunnel surgery. They're taking the pressure off so that the nerve can heal itself better. Now, if you can take the pressure off the nerve yourself without the surgery, voila! Isn't that better? So I really encourage you to get my program, and if you're considering getting carpal tunnel surgery tomorrow, if your mind's set up on it, fixed on getting the surgery tomorrow or next week or whatever, my program's not going to have time enough to help you. Give it, a couple weeks or so. For some people, the results are absolutely immediate. But if it's been building up for quite a while, it may take longer. But it's not going to take more than 5 minutes 3 times a day for a week or 2 or 3, and that's a lot better than having to go through surgery and have problems for 3 weeks to 3 months. And some people, they never get better. So it's up to you. I've said what I need to say. Thank you.